with me, Interim Fire Chief Greg Blasky and Police Chief Al Rochner. They can answer specific questions you may have about what our first responders are doing here in Joliet. But real quickly, I have, there's a couple flyers that we're handing out. If I can go down to one, and then we'll open up for questions. Number one, regarding public meetings, the city is going to implement a protocol to allow for critical meetings to be held utilizing the recommended social distancing guidelines as recommended by the CDC. The decision to hold or cancel meetings will be based upon a determination of need. The city seeks to balance the necessity to continue effective governmental operations with a concern for minimizing physical contact. So specifically, the pre-council meeting this evening is going to be canceled. The council meeting tomorrow night, March 17th, will be held. As you can see, we've rearranged council chambers, so the regular seating is not going to be available. We're trying to, again, maintain the protocol that the CDC is setting down. And then specifically about tomorrow night's meeting, the two public hearings, and obviously the North Point public hearing have been a big concern, are not going to be on the, or they will be on the agenda. The public hearings will be opened and then they'll be continued. So there's not going to be any action on those public hearings tomorrow night. Our plan is to, and obviously this is a fluid situation, it seems to be changing every day, but our plan is to reach out to the governor's office and the Illinois Attorney General's office to find out what recommendations they have to best move forward with issues like public hearings over the next few weeks, or maybe not, but the next couple months. Number two, due to the uncertain community effects and unknown duration of the COVID-19 threat, the mayor's office is declaring a local state of emergency in accordance with city ordinances. The declaration will allow flexibility in rulemaking and financial expenditures that may become necessary. Number three, city staff. Staff will continue to deliver the community the current high level of service expected. Precautions are being taken to indemnify staff members who may be placed upon split shifts or work remotely in order to minimize public service risk should the COVID-19 virus infect staff members. Number four, senior resources. The city is examining what resources may be tapped to aid with senior citizens or individuals who may become quarantined. Communications on resources will be provided once further information is available. Number five, utility billing and fines. To encourage online payment of city billing or fines during the duration of the state of emergency, the city will provide a credit effective today, March 16th, for credit card service charges incurred in paying a bill. Late fees will be waived during the period of the state of emergency. Number six, on water shutoffs. To maintain health and sanitation during the state of emergency, all water shutoffs will be suspended. Number seven, at the present time, the city intends to continue operations at all city facilities. Extraordinary cleaning of public areas is presently being conducted, and social distancing will be implemented for those visiting the facilities. Number eight, the governor has mandated that restaurants and bars across the state are to be closed from Monday evening today until March 30th. The city will be working to ensure that this mandatory closure is followed. The ban does not apply to delivery of food or drive-up or drive-through orders. Then number nine, COVID-19 communications. Bilingual resource page is on the city website at www.joliet.gov pertaining to the virus. This page will be used for community updates and information pertaining to the pandemic. It is likely that the city will continue to arrange for press conferences moving forward. So that's a real brief rundown of what we're doing here at City Hall. I do have, again, the fire chief and the police chief. I'm going to ask them to step forward and address you guys, and then if there's any questions, we'd be happy to open it up and answer your questions. Chief.
Good afternoon. Just a few things that we're doing as a police department. We're going to continue to provide the excellent service that we've always provided. That's not going to slow down or stop, so everyone understands. Some things we're doing in that respect, though, any police calls that can be handled online or handled through our TRUE system, which is our telephone reporting system, will be handled that way. People will be told that, no exception on those. All other services, we will continue, of course, to answer calls. If we do come to your residence, please, an officer will probably ask you to step outside to speak with them. We'll try to maintain that 6 feet distance when possible. Emergency calls, all bets are off on those. We'll handle them the way we need to. But basic calls where we can just talk, we'll try to keep that distance with everyone to keep everyone safe. Some other things internally that we're doing, we're limiting contact between our employees We have instituted rolling roll calls where we give all the information for the day out over the radio so officers can start work from home instead of coming to the station and meeting up with everyone. Also our dispatch center, which is crucial to our operations, we're locking that down to those employees only. No officer visits for information. They'll have to be handled through the phone. We're looking at separating some staff if it's possible in that respect. We're working on that this week. Cleaning, we're doing cleaning throughout the building every few hours in our main areas where the public is welcome at this point. If that changes, I will let everyone know if there's a need to close down our front desk area. We do have glass barriers, and if we can have people keep their distance, we may be able to continue that business in that manner, and if not, we will close that down. So those are some things that we're doing. I'm sure there's more, but I'll have the fire chief talk now, and then we'll answer some questions.
Good afternoon, Greg Blasky, Interim Fire Chief. The Joliet Fire Department is continuing to provide service to our citizens and has not reduced the number of firefighters working. All 9 stations are operational and staffed. We continue to monitor the information from IDPH as well as the CDC for any direction or changes. We also remain in contact with Silver Cross Hospital as well as Amita St. Joseph's Hospital. We are being proactive by having our communications center ask additional questions of those who call into 911 with flu-like symptoms. If so, the crews are being notified in advance by the communications center if there is a suspected COVID-19 patient. At this time, we have had 3 potential COVID-19 patients based on the information provided at the communications center, but it was deemed that they were not positive for the virus. Crews are being outfitted with personal protective equipment, including the N95 respirator, gloves, and gowns. If we deplete our stock of N95 respirators, the CDC has approved use of surgical masks until the stock of N95s can be replenished. We also have the option of air packs if necessary. If we begin to receive a large number of calls for COVID-19 exposed patients, we will implement a plan where additional ambulances will be placed in service with their sole duty will be to address these patients. This will minimize exposure to our department personnel and the frontline ambulances. We are asking the public to assist us by following the precautions outlined by the state of Illinois, the IDPH, and the CDC. Thank you.
We also have Ruth Colby from Silver Cross Hospital here. Thank you, Ruth.
Good afternoon. My name is Ruth Colby. I'm the President and CEO of Silver Cross Hospital, and that was a great segue. We are working very, very closely with emergency preparedness, first responders, and of course the Will County Health Department is right at the front line. The fire chief mentioned that there are guidelines from the Illinois Department of Public Health. I have copies of that for all of you. The more you can share with the public what are the symptoms and the conditions under which an individual might want to be tested. We are not having mass testing right now. There is not enough test kits or other equipment to do that. Plus, most people who aren't exhibiting the symptoms or haven't had contact or haven't traveled outside the country probably don't need it. But I will leave these with you, and I'm sure you have the same ones. Just so you know, the hospital community is absolutely mobilized to deal with this virus. We are always prepared to deal with emergencies. So we've dealt with viruses before with epidemics, not necessarily pandemics, but we have our emergency preparedness plan in place, and we are ready to take care of this community, as I'm sure that St. Joe's Hospital is as well. What's important for everyone to remember, wash your hands. That is critical. Washing hands, sneezing, coughing in an arm. This is an infection that spreads through droplets, so we don't want people spraying things from their mouths. And cleaning counters on a regular basis with a bleach substance is a way to help control the virus. Our website is updated daily. We have information. It changes by the minute. We also have a link to the CDC. The CDC has excellent information on questions about COVID-19. That's pretty much my update, and I'm happy to answer any questions. Thank you.
Yes.
Chief Blasky, could you go over those 3 cases and you said you had symptoms, what happened?
Yeah, repeat the question.
Repeat the question. go over again, though, you said you had 3 cases where people
The question was, could I go over the 3 cases of those potential COVID patients? So the questions that come from our communications center, they're very generic. However, what they narrow it down to is, has the patient traveled outside the country? That was early on. However, we know that's not necessary anymore because the virus is here. Does the patient have active fever, cough, and trouble breathing? Those 3 are our trigger points. So if those 3 things meet the criteria, then our crews are told to use droplet precautions. And again, of those 3 potentials, based on those 3 items, they were determined once they reached the hospital that they were not positive for the virus.
Chief Rochner, could you comment on some of the types of things that are you doing by phone or online as opposed to in person?
Yeah, sure. A lot of those calls would be criminal damage to property, calls where there's no suspects on scene, things where there's no threat to someone's life or danger to the community. Those are the type of calls. So, like I said, criminal damage to property, past tense burglaries, stuff like that, we can do over the phone. Telephone threats, anything that fits that criteria where there's no danger to the person by us not being physically present.
Can you kind of characterize about how much that's reducing in-person contact?
You want me to, characterize how much that's helping with reducing it? We just put it into effect this week, so I don't exactly know that, but I can get that for you, just talking to radio personnel on the calls coming in.
Yeah, a lot of those calls usually come in person.
Yeah, a lot of times what we'll do is we'll encourage people to use those outlets, but we'll also, if they want an officer present, we will send one. At this point, we will tell them that they have to use those outlets. We will not be sending the officer for those calls, so that's the difference.
The question was, have we seen a spike in calls for flu? And we have not.
Mayor, you mentioned public hearings to be delayed weeks, maybe months. Can you tell me what the process is going through right now?
The questions about public hearings being delayed, we don't know, Bob, it's fluid. We met Friday afternoon, myself and Steve Jones and staff, with the intention of moving forward today and tomorrow. Obviously, the situation between Friday and Monday morning changed, so we readdressed it on Monday. I think the plan is at this point is to get some feedback from not only the governor's office, but the Attorney General, to make sure that we are in compliance with the Open Meetings Act and any law, and also with the directives that are being issued by the governor. So, we intend on moving forward, certainly with our city council meeting, but the larger issues in the public hearings need to be addressed. We're going to do so in a responsible and legal manner.
The North Point one obviously would have drawn a lot of people. The other public hearings is fairly small matter. Is the idea of not having any public hearings that might create a public meeting at this point?
Yeah, the question is, was there a distinction between North Point and the other hearing? Is that what you're asking?
Well, the other one would not have brought a lot of people to the meeting, but is the approach now that you'll have no public hearings because they'll bring people to the meeting?
Well, we're going to have them. Again, I'm not sure how we're going to do it. It's kind of up in the air. We wanted, I don't think anyone in the city staff was treating the North Point issue differently than any other issue. And certainly, we're going to treat that differently than the other public hearing. They're all being treated the same.
Also, you had mentioned certain measures being considered for senior citizens. Can you discuss at all what's being considered?
Yeah, the question is, what are we considering with senior citizens? This is a work in progress, but if you're familiar, a couple of years ago, we instituted a program at the city, a volunteer program where people were signing up for free snow shovel or snow removal, and we asked for seniors or people with disabilities to sign up. The program went very well. So in that vein, what we're working on here, we have city staff working on, is to set up a portal where seniors can reach out and ask for assistance from the city. Obviously, this disease appears to be targeting or attacking seniors at a real disproportionate rate. They seem to be the ones that are most in line right now. So if there are seniors who want to self-quarantine but need assistance getting food or getting their medication, we're going to set up a program here at City Hall where city staff or volunteers from the community can assist in doing that. If people want to volunteer, Steve, I don't know if we have,
Steve Jones, interim city manager. This is really a work in progress. We started this discussion about 10 o'clock this morning. As we get some of the specifics, we're going to be talking to some of the senior social service agencies. We have some staff perhaps who won't be doing some internal inspections because of the contact being limited. Perhaps we utilize them as well. So as the details of the program are put together, we'll certainly let everyone know via press release.
Okay, so that's not started yet, so we shouldn't say that.
That's correct. It's a work in progress.
you will be getting information though in the days to come about this. Yes.
So are you legally required to open the public hearing tomorrow night and then continue it? Is that why you're still?
Yeah, the question is about the procedure with the public hearing in North Point. Yeah, it's on the agenda. We will open the hearing, but we're going to continue it. So, you know, our hope is, obviously people are welcome to come, but there really won't be a reason for it tomorrow. But again, we're going to proceed. Again, we want to do it in a safe manner. We don't want to endanger anybody. At previous meetings, there have been seniors who had come to speak about it, so I think that was a real concern. So we're going to get some directives again from the governor's office and from the attorney general, and then we'll be looking to move forward with that and with other city business.
Comments electronically? People can have something set up to that?
We do, Steve.
We've been, Steve Jones, the question was, are we going to take questions electronically? I'd say over the last 2 to 3 weeks, we've received a number of electronic comments, both on the pro side and on the con side. And I should put out that last week, when we thought we were moving forward, we did do a press release that indicated folks could certainly comment directly to our city clerk, and we would get all those comments to council. Even though that 6 o'clock schedule that we had put together is no longer relevant because the meeting isn't happening, we always pass these directly on. I mean, residents of this community know the email numbers and oftentimes the cell phone numbers of our elected officials, so I think they know how to get in touch with our elected officials.
How does delaying this vote from the hearing test, how does delaying that affect
I have it. Maybe you can answer.
The question is, how does it affect North Point? Over the weekend, I had reached out to the developer and indicated that in view of the fact CDC, the state, were issuing new edicts, that there was a good chance that this thing would be deferred. I indicated that to them and they said, understood. So simple as that.
Seems like a lot has changed just over the weekend. I think you alluded to that, Mayor. Can you talk a little bit about how much you had to reconsider things Monday based on fast changing circumstances?
Yeah, it's been ongoing. I had, the governor's office had been doing conference calls with local officials, so that had been ongoing. Thursday afternoon, when Governor Pritzker made his announcements or his proclamation, I spoke with the governor's office that day, and I specifically asked whether closing schools was going to happen. The answer was no, but obviously that changed Friday. When his directive Thursday outlawed meetings of over 1,000 people, and we're making recommendations against meetings of 250 or more people. And again, at least by yesterday, that had changed. The CDC was now saying meetings of 50 people or more should be avoided. So it really is fluid, it's ongoing. Like I said, when we left Friday afternoon, we thought we had a plan in place that would be safe and comply with the governor's directives, but those have basically changed since Friday. So that's why this morning at 8 o'clock, myself, Councilwoman Quillman, and staff had a meeting, and we came to the conclusion that this was the right way to go. And then some of the other things that have happened subsequent, including calling a press conference and letting local media ask questions about what the city's doing now.
Colby, can you comment at all about flu in the community, whether the hospital's seen any cases of coronavirus?
So the question is about flu in the community and have we seen any coronavirus patients? We started out in January with a very big flu season. We are starting to see that taper off. And in fact, in an effort to conserve protective equipment, I've dropped the masking policy for those people who did not receive flu vaccines at the hospital, people who work there. It's a very small percentage of people, but conserve protective gear for cases that may be coronavirus cases. We have tested several people for COVID-19, and there have been no positive results at this time. At this time, right now, and as the mayor said, information changes rapidly. There has not been a reported COVID-19 case in Illinois. Is that? I'm sorry, not Illinois, in Will County. I'm sorry, Will County. In Illinois, there's over 90 cases.
One last thing for me, can you explain a little bit more about how the water billing credit is going to work? I don't quite understand that.
Jim, is a 3% charge for using a credit card? Is that correct? The question is about the water billing credit. What we're encouraging people, if they can pay online, not to come to City Hall if possible, just to minimize the contact. There is a 3% surcharge for using a credit card. We're not going to waive that fee, but we will apply it to the next water bill. Well, I want to thank you for coming out. If you had any other questions, we'll be available. There's also a couple flyers. The press release from this event, the declaration of local state of emergency, and also an email exchange Saturday between myself and members of the governor's office. It was reported locally this morning that Governor Pritzker tried to stop the meeting and that I was refusing to do so. That's incorrect. The email exchange, I think, is self-explanatory, that did not happen. Thank you for coming out.